Can everyone please rise for the national anthem to be played? You may be seated. Good afternoon and welcome to the 2025 UTHealth Houston School of Public Health Commencement Ceremony. I am Eric Borwinkle, Dean of the UTHealth Houston School of Public Health, and it is my honor to welcome you all and welcome Interim President LaTanya Love, guest speaker Ismail Porsa, UTHealth Houston and School of Public Health leadership who join me here on stage, our distinguished faculty, graduate students, families, and friends to today's commencement celebration. Now I am pleased to introduce the Interim President of UTHealth Houston, Dr. LaTanya Love.
Thank you, Dr. Borwinkle. Good afternoon, everyone. To our esteemed graduates, family, and friends, welcome to the 2025 Commencement Ceremony for UTHealth Houston School of Public Health. Today, we gather to celebrate such an incredible milestone, and it is truly my honor to address you on this momentous occasion. Graduates, your dedication to the advancement of public and population health really inspires us all. You chose a path that demands courage, compassion, and an unwavering determination to improve lives. Each and every one of you has made sacrifices and worked tirelessly to get here, and now it is time for us to celebrate your success and the bright future ahead. As you step forward into this exciting new chapter, please remember this. You carry with you the knowledge, skills, and resilience forged right here at UTHealth Houston. You forever will be part of a community that thrives on collaboration, innovation, and a shared mission to make a difference. And your experiences here in the largest medical center, the TMC, and beyond have fully prepared you to heal, to lead, to find solutions, and to transform health and health care. You are now part of an exceptional legacy, one that includes more than 55,000 UTHealth Houston alumni who have driven meaningful advances across the spectrum of health sciences. With curiosity, creativity, and a commitment to excellence, you will continue the long-standing tradition as a standout who stands for the improved health of your patients and the communities that you serve. Finally, I want to acknowledge the families and loved ones here today. Your support and encouragement have made this possible. Let's take a moment to show our gratitude with a well-deserved round of applause. Graduates, you have already accomplished so much, and the best is yet to come. On behalf of all of us right here at UTHealth Houston, congratulations. We are immensely proud of you, and we cannot wait to see the positive changes you will make as the next generation of public health professionals dedicated to excellence. Thank you.
Thank you, Dr. Love. Members of the 56th graduating class of UTHealth Houston School of Public Health, please stand. We are here to honor you, but your journey has not been alone. We all stand on the shoulders of family, friends, and mentors. So graduates, look around and out into the stands and give a loud applause and a big hoop and big holler of thanks to those who have helped you get here today. Thanks, and please be seated now. By completing your degree, you have reinforced the strength and resilience of the school and the profession. Public health's defining characteristics is we are proactive rather than reactive, constantly trying to get ahead of problems. As you embark on your careers, I encourage you to first and foremost remember the impact of your work. Public health plays a critical role in the prevention of disease, the promotion of health, and improved health outcomes. Your efforts will have a significant impact on the lives of thousands of people in our communities and across the state and nation. Thanks to your hard work and the continued commitment to excellence of our faculty and staff, we are once again ranked nationally in the top 10 for public universities' schools of public health. The diploma you will receive today is more than a document of your learned achievement, but it's also a key that will unlock doors to new opportunities in diverse and expanding field, working to address the most pressing issues facing us today. Led by the energy, dedication of our students, the school has doubled down on the commitment to health, safety, and access to necessary and affordable health care as a fundamental right for all. As we gather today, I'm excited to share the continued progress on the construction of the new School of Public Health building. It is fitting that the school's new building serves as an anchor within the new Helix Park campus in the Texas Medical Center and the hub of health discovery and innovation in Texas and the world. Fueling the engine of that innovation is research. A passion for discovery and revealing what separates the known from the unknown has been a defining characteristic of my life and the lives of many of my colleagues here today. That spark is what drives meaningful change, and I encourage you to seek discovery and continue to shape the future of public health. Graduates, I wish you luck as you seek your own passions and adventures, and I wish good health to you, your families, and your loved ones. Thank you, and congratulations. With those introductory words, it is my great pleasure to introduce this year's commencement speaker, Dr. Ismail Porsa. Dr. Porsa serves as the President and Chief Executive Officer for Harris Health, which is a community-focused academic and safety net healthcare system dedicated to improving the health of those in most in need in Harris County, Texas, through quality care delivery, coordination of care, and education. Harris Health operates 45 community-based clinics, health centers, and specialty locations, and 2 trauma hospitals, Ben Taub and Lyndon B. Johnson Hospital. The system provides high-quality care and treatment for nearly 1.6 million outpatient and more than 36,000 hospital cases each year. Dr. Porsa has a special interest in improving population health through addressing non-medical drivers of health and healthcare delivery in correctional settings. Please join me in welcoming Dr. Porsa to the podium.
Good afternoon, everyone. This is really an amazing honor. Let me tell you guys, I am truly humbled by being invited to speak to you all today. But let me start, and hopefully I will finish, by saying congratulations first and foremost to all of you and your family members and loved ones, without whom I dare to say that most of us would not be here today. So congratulations first and foremost. Y'all, I realize that today is about you and your achievements, your accomplishments, and as such, I promise I'm going to be brief. As I was going over my notes last night, my wife told me, you realize that none of the graduates are gonna listen to what you have to say. They're all thinking about the after party. You're gonna be talking to their parents and loved ones in the audience. Be that as it may, I would like to share the next few minutes with you and share with you my thoughts on what I believe the future of healthcare should be. All right, so as a start, I did probably what most of you would have done. I asked ChatGPT, what is the future of healthcare? This is what I got. The future of healthcare is a dynamic landscape that is being shaped by advancements in technology, changes in patient needs and preferences, and evolving healthcare policies. Here are some key trends and developments that are likely to influence the future of healthcare: telehealth, artificial intelligence, robotics and automation, and a whole bunch of other things, and at the end, precision medicine. Now, I'm willing to bet that when I said precision medicine, a lot of you, if not all of you, started thinking about genomics and nanobots delivering chemotherapy agents or therapeutics medications to diseased organs in the human body. And you wouldn't be wrong. As a matter of fact, if I'm not mistaken, there is a leading healthcare system in our community that has an ongoing ad on TV saying that through this exact process, they are leading our future for healthcare. But is that really what we can all hope for? Obviously, I don't agree, so let me explain why. So I would like for us to consider using the term precision medicine to mean something a little different, or perhaps entirely different. What if precision medicine simply referred to the delivery of right care, not necessarily medical care, to the right population of people at the right time, in the right amount, and in the right setting? Consider this. For centuries, life expectancy for humans hovered around 20 years, 20. The reason for that was mainly because almost 60% of the infants did not make it to their first year of birth, their first birthday. In the early to mid 20th century, the discovery of vaccines, antibiotics, insulin dramatically increased our life expectancy. The trend continued for many years. Then we had the creation of MRIs, CT scanners, and better cancer screening and treatments, and all those things. And in fact, increase in our life expectancy became the ultimate proof of our progress in improving our health in the 20th century America. Decade by decade, the number kept climbing. And by 2010, the country, our country, appeared to be marching unimpededly towards the milestone of 80. But we never got there. until just this last year, and only for women. So women currently in the United States have an average life expectancy of 80. Men, not yet. In fact, after a peak of 79 years of life expectancy in the US, the life expectancy hit a plateau, and then it began to decline in 2019. In 2020, it dropped to 74. This is where we were in 1999. By far, the worst life expectancy among all Western countries. So what is the future of healthcare? Or better question yet, what should the future of healthcare be? I ask this because the art and science of medicine, I believe, have unfortunately and perhaps irreversibly been intertwined with the business of medicine. Today, the focus of healthcare is not necessarily the promotion of health and prevention of disease as much as it is on generating revenue through managing chronic illnesses. Creation of increasingly more sophisticated and more expensive technology and medicine in the name of improving healthcare has dramatically shifted our focus away from what we know to be the most important in our overall health. That is the non-medical or social drivers of health and disease prevention. And instead, more and more towards the shiny new drugs, technologies, and machines. It is true that our life expectancy has improved due to better and more sensitive screenings and diagnostics and better treatments. The question is, by how much and at what cost? Today, we spend more money on healthcare in total and per capita than any country in the world, while our overall health outcomes and our life expectancy lags behind every developed country in the world, and even some developing countries. So I ask, why? It is obviously not for the lack of spending. The United States spends on healthcare more than 3 times any other nation on earth. It is not for lack of infrastructure. We have some of the best hospitals and health systems in the world. Houston is home to the largest collection of hospitals and health systems in the world. It is not for lack of knowledge. The United States continues to lead the world in healthcare research and discovery, at least until recently. We'll see what happens from now on. So what gives? I propose to you 2 things. One, that we are simply focusing on the wrong end of the spectrum of what matters most when it comes to our health. And number 2, the very present and very serious issue of health inequity that continues to exist in our country. Starting with the profit-driven focus on managing illnesses instead of promoting health and preventing disease. We spend millions, if not billions of dollars each year in research focused on creating new drugs, new technologies, and new gadgets to treat chronic illnesses and quote-unquote cure cancer. All the while, we know for a fact that preventing illnesses, including cancer, or even postponing the onset of chronic illness and cancer, improves the overall health and well-being of our communities and will dramatically reduce the cost of care. Knowing this, would it not be in our collective best interest to shift our focus away from the shiny new drugs and gadgets that can at best prolong life in a diseased state for a few weeks or at most for a few months, but instead focus more of our attention, energy, and resources on increasing our health promotion and disease prevention efforts, especially in our children and young adults. Science is very clear on the importance of social determinants of health. While less than 20% of things that impact our health, things that you and I refer to as healthcare, our doctors, nurses, clinics, hospitals, get more than 95% of our entire annual healthcare expenditure, or more than $4 trillion, the non-medical or social determinants of health, things that impact 80% of our health, get less than 5% of the national healthcare expenditure. These include things like the air that we breathe, the water that we drink, the food that we eat, our education, our employment, our housing, etc. We all have heard the definition of insanity, doing the same thing and expecting something different, an outcome that is different. So I'll go back to the term precision medicine. By precise, I would offer to you only the appropriate application of our intention of our funding. And by medicine, I would offer all that makes us healthy and maintains our health. I'm speaking of health promotion and disease prevention efforts, especially in early childhood, adolescence, and early adulthood. I'm speaking of investing in maternal health and early childhood education, gainful employment and livable wages, universal access to healthcare basics, including vaccinations and early screening for common disease processes and most common types of cancer, safe housing and an end to homelessness, access to nutritious and fresh foods and vegetables, putting a stop to our self-destructive practice of polluting our air and water. It is only through these practices that we can truly take the next step in improving our overall health and well-being and bring sanity back to healthcare. It is about investing our resources more wisely so that we can get the biggest bang for our buck and at the same time reap the benefits of a healthier, happier, and longer life. I now want to shift our conversation to the issue of health disparities that continues to plague our nation. While it is true that our overall life expectancy has improved by several decades over the last 100 years, this improvement is not experienced equally by all who call the United States home. Our minority communities continue to experience more morbidity and mortality, including maternal and infant deaths, which dramatically lowers their overall life expectancy as a population. As we look into the future of healthcare in our country, what it should and can look like, addressing the root causes of the significant health inequities that exist in our communities must be front and center. We all know by now that life expectancy here in Houston, in some of our communities with large proportion of Black and brown residents, is significantly lower than our more affluent, more white communities. It begs the question as to why. Black and brown people are not genetically predisposed to dying early. They die of pregnancy and postpartum complications. They die because they are forced by design to live in more industrial parts of our communities where we know that the air and water are polluted. They die because of a very early age, they lack access to basic health services. They die of early onset of chronic diseases, including hypertension, diabetes, and yes, all types of cancer. They die because these conditions are not identified early enough, and once identified, they are not treated aggressively enough. They die because they're exposed to generational poverty, which deprives them of access to early childhood education that can later on set them up for future success, including higher paid jobs. And they die because of suffering the persistent microtrauma of being exposed to an unjust criminal justice system that disproportionately incarcerates Black and brown Americans. So what do I hope the future of healthcare can and should look like? I hope for a future in which we shift our focus from managing chronic illnesses to preventing diseases, maintaining health, and promoting wellness. I hope for a future in which we are preoccupied with cancer prevention, screening, and early diagnosis instead of breaking the bank to postpone the end of life by just a few weeks. I hope for a future in which healthcare providers are paid for outcomes of their care and not the volume of their services. I hope for a future in which mental health is integrated into our overall approach to healthcare. I hope for a future in which we don't treat our mentally ill and the poor as criminals. I hope for a future in which we put an end to our apparently insatiable appetite for mass incarceration. I hope for a future in which our life expectancy does not depend on the skin of our color, and the color of our skin, or our zip code. And ultimately, I hope for a future in which access to healthcare is considered an undeniable human right and not a status-linked privilege. I look at all of you today with a profound hope that as the next generation of thought leaders, you can help move our communities and our country in a new direction, one in which we can truly achieve a better health for all. We are all aware of the shift in priorities of our elected officials locally, statewide, and nationally. While we may or may not agree with some of the proposed or implemented changes, it is up to us, every one of us, to do what we can to help secure a healthier future for all who call our great country home. I would like to share a parable of the hummingbird with all of you at this point, courtesy of some of the indigenous tribes in South America. And the story goes like this. There's this beautiful jungle. Every animal is living in peace. And a big fire breaks out. And the animals are all escaping their homeland. And there's this hummingbird who keeps flying back and forth to the river and back to his nest, carrying one drop of water every time. And the elephant asks the hummingbird, "What are you doing?" And the hummingbird says, "I'm doing what I can." So, at the end of the day, all that any of us can expect of ourselves and each other is to simply do what we can. So do what you can with the knowledge that you have gained over these past few years at the, I knew I was going to get this wrong, University of Texas, no, UTHealth Houston School of Public Health. There you go. Got it. Got it. What you have learned over this past few years to guide us to a healthier future. Again, thank you so much for this honor. It has been a pleasure talking to you all. I wish you all the best. Congratulations one more time, and God bless.
Thank you, Dr. Porsa, for those wise words. May I now introduce Saeed Hussein, Associate Director of the School of Public Health Student Association, for a presentation of the John P. McGovern Outstanding Teaching Award.
Thank you, Dr. Borwinkle, and good afternoon all. My name is Syed Haider Hussein, and I'm a doctoral student in healthcare management and health policy at the UTHealth Houston School of Public Health, as well as the Associate Director of the School of Public Health Student Association. To the graduating class, I would want to begin by saying congratulations. You've made it through all of the discussion boards, the exams, the papers, the group projects, and the presentations, and you're still standing here ready to take on the world. Each one of you has contributed to this institution's legacy and to the future of public health, especially during a time when the world needs public health champions more than ever. The challenges you have and will continue to tackle are anything but theoretical. Public health isn't something you just studied. It is something you've practiced every step of the way. As you move forward into your careers, and hopefully take a little bit of break before that, you do so as a new generation of public health professionals who lead with compassion, evidence, and the type of resilience shaped by late nights, tight deadlines, and the near impossible task of scheduling a meeting with 5 people across 4 different time zones. Of course, none of this will be possible without the leadership and guidance of our school faculty and leadership who challenge and inspire us. I am honored to present one of our school's most meaningful student-nominated awards, the John P. McGovern Award for Outstanding Teaching. This year's recipient is Dr. Abigail Sidori. Dr. Sidori is an assistant professor in the Department of Biostatistics. She earned both her Master's of Science and her PhD in Biostatistics from the UTHealth Houston School of Public Health. Her passion for mentorship, innovative teaching style, and thoughtful guidance have left a lasting impression on all of us. She brings clarity, curiosity, and just the right amount of pressure to help you reshape and refine your final project just in time for the deadline. Please join me in congratulating and welcoming Dr. Abigail Sidori to the stage.
Thank you. Thank you, Said. Good afternoon, everyone. Hello, all graduates, faculty, staff, friends, family, everyone here. It is truly an honor to speak to all of you today as the recipient of this year's John P. McGovern Outstanding Teaching Award. 5 years ago, I should have been sitting right where you all are now, waiting excitedly to walk the stage and receive my doctoral degree. But the pandemic had some other plans. Now, this award really reflects the outstanding faculty at UTHealth Houston School of Public Health. Having earned both my master's degree and PhD at the School of Public Health, I had the pleasure of taking courses with many of our incredible instructors. It's their expertise and patience, compassion towards students that influence my teaching and inspire me to continue improving the quality of education and instruction. It should be encouraging for all of you to know that each and every one of you has received the best education from an excellent array of faculty. I want to thank all of my colleagues for your collaboration and assistance in getting me to where I am today. I also want to thank all of my family and friends who have supported me over the years. But I especially want to thank you, the students, for not only nominating me for this award, but for also teaching me and continuing to inspire me every single term. You are the reason I do what I do. Your success and seeing that light turn on, especially when I know statistics isn't always the easiest subject to master, it really drives me to do better and be better as an educator. I am truly blessed to have the ability to do what I love and to be recognized for all the hard work and dedication that goes into teaching. Now that you have completed your degree program, I hope that you are as fortunate as I was to find a position that fulfills all of your passions. I wish you all the best of luck in the future and congratulations on making it here today. Thank you.
Thank you, Said and Dr. Sidori, and all of our faculty and staff for their commitment and dedication to the academic and professional development of our students. Now it is time for the presentation of the candidates and the awarding of the degrees. After all, this is why we're here. Will the candidates for the degree of Doctor of Philosophy please rise? Dr. Love, on behalf of the faculty of the School of Public Health, it is my pleasure to certify to you that the candidates who stand before you have successfully completed all academic requirements for the degree of Doctor of Philosophy.
By virtue of the authority vested by law in the Board of Regents of the University of Texas System, I now confer upon each of you the degree of Doctor of Philosophy, for which you have been recommended with all rights, privileges, responsibilities, and obligations pertaining thereunto, and I offer my sincere congratulations to each of you.
Jennifer Nethery Iyer. Andrea Anna Entwig. Ibrahim Balhareth. Emma Catherine Jane Berquist. Taylor Nicole Castillo.
Once they move to the hooding, let's call the next one. Once they shift sides, you can call the next one.
When they,
We don't need to wait for them to get off. Yep, so you can call
so I
right
can
now.
go now? All right. Hey Kit Chen. Katazina. Katazina. Katarzyna Czerniak. John Spencer Fennell. Mike Henson Garcia. Martha Isaura Gonzalez Garcia. Anayeli Herrera Morales. Shinran Wang. Aisha Khan. Kan Lee. Andi Liu. Sori Kim Lundin. Bumadevi Narendran. Omobola Oludamilola Oluwafemi. Samson Adebayo Oyediran. Susan Lackey Parker. Cesar Leonardo Pinzon Gomez. Catherine Pullican. Ray Hartz. Hannah Rayhart. Matthew Roth. Sharmili Guha Roy. Kayla Elizabeth Rush. Andrew Say. Tiffany Siraj. Jenny Tang. Isaac Valdez. Yishun Wang. Jessica Nicole Wise. Xian Shu. Zitong Zhang. Zitong. Zitong Zhang. Yiqing Xuan. Nena Mba Odowusi. Wei Tao. Sound at the main podium.
There we go. Thank you. Will the candidates for the degree of Doctor of Public Health please rise? Dr. Love, on behalf of the faculty of the School of Public Health, it is my pleasure to certify to you that the candidates who stand before you have successfully completed all academic requirements for the degree of Doctor of Public Health.
By virtue of the authority vested by law in the Board of Regents of the University of Texas System, I now confer upon each of you the degree of Doctor of Public Health for which you have been recommended with all rights, privileges, responsibilities, and obligations pertaining thereunto, and I offer my sincere congratulations to each of you.
Melissa Renee Cruz. Priscila Damaris Garza. Jesse Gavin. Lisa Ann Mitchell Bennett. Joanne Aurelie Monroy. Marianne Okure Olaniran. Niles Zoski.
Will the candidates for the degree of Masters in Public Health please rise? Oops. You guys look beautiful. Dr. Love, on behalf of the faculty of the School of Public Health, it is my pleasure to certify to you that the candidates who stand before you have successfully completed all academic requirements for the degree of Master of Public Health.
By virtue of the authority vested by law in the Board of Regents of the University of Texas System, I now confer upon each of you the degree of Masters in Public Health, for which you have been recommended with all rights, privileges, responsibilities, and obligations pertaining thereunto. And I offer my sincere congratulations to each of you.
Oguchukwu Ruth Abasilim. Ganiat Ola Adejuan. Akriti Agrawal. Abena Quartama Eje. Zaid Ahmed. Oluwatoyin Elizabeth Akanji. Kelsey Michaela Aiken. Ria Alex. Heather Joy Alexander Dahl. Jenny Emily Alvarado. Abida Anwar. Hafsa Arain. Gonzalo Astudillo. Sofia Ballesteros. Amber Janae Barrow. Patrick Munguiko Bazija. Laura Bedini. Shyla Bentley. Andrea Berdegay. Antoinette W.J.H.M. Bernal Tent. Catherine Grace Boykin. Essence Bryant Kendrick. Beloved Montserrat Buentello. Belinda Busogi. Alma Jacqueline Canales. Cielo Carreño. Rachel Sarah Ruth Chaco. Mia Soledad Chan. Spencer Lyle Chichester. Mary Chilson Partridge. Chandana Chitraleka. Ivy Kokuzi. Mia Chin. Amanda Denise Daniels. Alexandria Cantu Dawson. Catherine Daisy DeBeer. Leah de Blasio. Victoria Hope de Luna. Katerina de Sheva. Stephen Despain. Efemena Michael Diajamoa. Vivian Kim Din. Kung Min Do. Augustine Akela. Laverne Etuck. Nellie Fisher. Madison Faith Floyd. Gabriel Brian Franklin. Kirsten Summer Gallegos. Tessa Dunn Galloso. Sandra Garcia. Ermelinda Garduño. Ria Gosel. Brittany Ray Gomes. Andrew Gonzalez. Carolina Granada. Elenis Marie Guajardo. Boy Bik Ha. Masroor Habib. Intisar Hakam. Gabrielle Zalea Haley. Amna Hamed. Olivia Harding. Valerie Harris. Mary Ellen Haynes. Carmen Hernandez. Hannah Yvette Hickman. Caitlin Ziem Lian Wang. Cassidy Nicole Hunt. Kiana Alexis Hunt. Nabil Hussein. Andrew Wynn. Alina S. Jacob. Hema Sarvani Jalaparti. Jessica Umfonisa Ita James. Nazakat U. Gilani. Amari Janae Johnson. Angelina Denise Johnson. Cabe Johnson. Temperance Joseph. Margaret Mary Camholz. Namrata Kandru. Sudha Cockerell. Hiba Sohail Khan. Pia Khosla. Youngjin Kim. Julia Kirk. Isabella Neeland. Disha Kohli. Maria Kutravelis. Caroline Marie Kraftcheck. Tolwula Lase and Yola Kuteyi. Zarna Prakshabal Lawani. Julie Lamb. Magna Lama. Matthew Lee. Carolina Berenice Lopez. Sarah Adele Lubani. Andrea Joyce Miklat Malabay. Aditya Vipul Mamlatdarna. Malaysia Angelique Marshall. Jada A. Martinez. Richard Martinez. Nicholas Andrew McCann. Monique Danielle McDonald. Sarah Elise McLean. Oyinkansola Temilade Magboyin. Kiana Morris. Kimia Motavassal. Bansari Atul Rajani.
Hi, Mom.
Marcos Ramirez. Safa Owais Moten. John Francis Nally Jr. Rachel Lockman Ng. Angela Unchup Wen. Casey Wynn. Kathleen Wynn. New Wynn. Victoria Page. David Palmer. Anjali Prakash Patel. Prisha Patel. Ruchi Nikhil Pavaskar. Lauren Payne. Keely Parrington. Angela Jessica Piasecki. Vernique H. Pinder. Kyla Lanier Pipkins. Ashma Pokarel. Reginald Peppera. Jacob Nizam Qureshi. Adishwar Rao. Diane Recto. Brian J. Rayburn. Christopher Daniel Reyes. Zena Victoria Rickster. Lawrence A. Robinson. Kendall Elizabeth Robinson. Jamie Rose. Gisela Astrid Saenz Rodriguez. Sanskriti. Rimsha S. Syed. Benjamin Amani Semakuba. Deep Manishbhai Shah. Fatimat Shamna. Diksha Sharma. Sydney Ann Sheridan. Sherindok Shirazi. Puranjay Shori. Amar Daniel Siddiqui. Nadia Siddiqui. Ria Singh. Suhasoni. Vyoma Jayesh Soni. Rachel Sung. Kritika Suri. Adeyemi Titilope Taylor. Hadiza Theria Inayas. Sasha Vijay Vergia. Jacqueline Marie Wheeler. Alyssa Williams. Anthony Ong Su. Geetika Yalavarti. Ruth Stephanie Yanes Bengoa. Justin Young. Brandon Rahman Zadeh. Sharon Graciela Zaldivar Alatorre. Susana Zavala. Sarah Jane Maldonado. Joseph Dang. Bhavik Kumar Nikul Kumar Trivedi. Dina Abdelaziz Fayed. Ashwarya Vijay Marathe Shinde.
Will the candidates for the degree of Masters of Science please rise? Dr. Love, on behalf of the faculty of the School of Public Health, it is my pleasure to certify to you that the candidates who stand before you have successfully completed all academic requirements for the degree of Master of Science.
By virtue of the authority vested by law in the Board of Regents of the University of Texas System, I now confer upon each of you the degree of Master of Science, for which you have been recommended with all rights, privileges, responsibilities, and obligations pertaining thereunto, and I offer my sincere congratulations to each of you.
Oluwadotun Catherine Balagun. Yusuf Benfala. Gracie Jane Huft. Justin Wynn. Michelle Quinan Tron. Anne Wong Vo. Yan Yu Yang. And Kennedy B. Zinn.
Graduates, congratulations to you all. Before we conclude our ceremony, I would like to recognize our graduates who have been nominated to join the Delta Omega Honorary Society, the Public Health Honorary Society of Accredited Schools and Programs of Public Health, which has been active in advancing public health education, practice, and research since 1924. The purpose of the Society is to encourage excellence in student scholarships and research, to recognize academic and professional achievement in the field of public health. Will the nominees please stand? Thank you, and please be seated. I actually forgot to mention before we started, the group with the loudest and most enthusiastic applause, there's a Chrysler Cordoba waiting for you out there. Please also help me recognize the donors and recipients, our endowed scholarships and training programs. I want to thank our generous donors for leaving legacies that support our students through their educational journeys. I would also like to thank our faculty sponsors for their efforts to garner funding for many of our training grants. These grants give students a depth of unmatched experience in specialized areas of public health. As we bring our commencement ceremony to a close, I would like again to offer my sincerest congratulations to this year's graduates. You will find that our degree will help you open many doors for years to come. Thank you for entrusting UTHealth Houston School of Public Health with your education. Best wishes for fulfilling an impactful career in public health. We will now begin the recessional, and I ask that all the guests please stay seated and our graduates and faculty until our graduates and faculty exit the room. I hope in the most sincere way that you enjoy this special day. Thank you.